Welcome to Chapter 8 of the U.S. healthcare system. This is a hard chapter. It is about payments and insurance, and it's hard. So I'm going to just go through it real quick because you're going to have to read about these concepts, but I have highlighted some key ones for you. This is basically how the healthcare spending, and this isn't follow your book exactly. I looked up for more recent figures, so this should be close to what's in your book, but it won't be dead on. As you can see, hospital is the single biggest chunk, clinics second, prescription drugs third, health insurance is basically what health insurance, their profit margin is number 6. Residential treatment like nursing facilities is 5%. Reinvestment, building new hospitals and stuff like that. Research is 5%. Then home health and public health are down around 3%, which is really a shame about public health because it's about home health and public health, both because they're both very cost-effective ways to keep people healthy and to reduce the overall burden of the healthcare system. But as you can see, they're some of the smallest expenditures. Health insurance, you have different plan types. Group health insurance, which is usually offered through your employer. The individual coverage, which is you just go online or meet an insurance agent and buy your own policy. Then if you buy group insurance self-funded, basically where your employer just pays out the claims, and that's it. And then managed care is kind of that prepayment type thing where you work with a healthcare provider and then they kind of funnel your care through them. You have voluntary insurance, which is again what you would say it's the stuff you sign up for through your employer. Social insurance, which is Medicare, and then public welfare, which is Medicaid. And then forms of payment, fee for service, which is the vast majority of it, is healthcare providers. They can provide a service, they submit a claim, they get paid. However, in some cases, like managed care, doctors will get paid a certain amount per patient, and they need to provide 80% of those patients with a physical in a year, and then that's all they're going to get. So, the idea is since they're capped on the total amount they're going to get per patient, they want to keep them as healthy as they can. And of course, premiums are what you pay every month for your insurance. So looking at different kinds of cost sharing, which is basically as a consumer, what you pay every time you go to the doctor. Co-payment, that's usually with office visits, sometimes ER visits, where it's $20 per visit regardless. Then the rest is going to be picked up by your insurance. A deductible is amount you're going to pay over a year. So let's say you have a $1,000 deductible, you're going to pay every penny of the first $1,000 of your health care before your co-insurance kicks in. Then that's a percentage. So let's say after 1,000, it's 20% co-insurance. You'll pay 20% of all your bills above 1,000 until you reach your out-of-pocket maximum. And then that's a number, let's say $5,000. Once you spend a total of $5,000 on healthcare for the year, you're done. Your health insurance picks up the rest. And I left a problem for you to figure out. If you can figure out how I got it, you've got it mastered, because it's not an easy one, but that's fairly normal. And then there you have the concepts of health savings accounts, health reimbursements accounts, and flexible spending accounts, which sound similar, but I assure you they are not. Now, as far as government-provided insurance, you have on the left, your left-hand side, Medicare Part A, B, C, and D. Very important to know these. Medicare Part A is hospital insurance. You get it when you turn 65 because you paid in all your life. Medicare Part B is your insurance you get that covers doctor's visits, and you have to pay a monthly premium to get Part B. So Part A you get just for turning 65. Part B you're eligible for at 65, but you do have to pay each month. And then I believe they can take it directly out of Social Security checks, but don't hold me to that. Part C, you don't see a lot of it. It is Medicare Managed Care. Maybe 20,000 people or less in Iowa have something like this. But it's basically a HMO who Medicare pays, and then they try to kind of keep things cheap by providing more preventive service and try to actually make money off the Medicare patients. Again, you don't see a lot of it. Part D is, D for drug. It is medication insurance. We've talked about the donut hole in Medicare Part D in previous chapters. So that's Part D. Also, you have Medigap. That is not a government program. That can be purchased through a private health insurance like a Blue Cross Blue Shield. That's going to cover all of the things that Medicare doesn't pay for, all of the premiums, copays, things like that. So that's an optional thing. You can basically hope that the leftover amount is what you can afford, not get Medigap, or you get Medigap, then you don't have to worry about it. Now, other government programs, Medicaid, again, that is for low income. CHIP is the Children's Health Insurance Program. It's Children's Health Insurance Program, CHIP. In Iowa, that's called Hawkeye. Again, it covers low income kids who don't qualify for Medicaid. You have workers' comp insurance. If you get hurt on the job, that pays for your injuries there. And then TRICARE is for active duty and retired military only. And it basically provides a network of providers that also includes military hospitals, which aren't open to normal people. So for reimbursement, you can look through these concepts. Again, it's tricky. Take a look at them and let me know if you have any questions. Same with this, bundled payments and ACOs. Again, they're just ways of paying. And then ACOs are accountable care organizations. They were created as part of the Affordable Care Act. And the idea that if we encourage providers to do less unnecessary testing, and then if the healthcare costs for a pool of patients drop, then they share the savings between the insurance company and the healthcare provider. So they actually get paid for not providing services under an ACO. Anyway, assignments for this chapter obviously will meet for your participation. There's a paper about the maldistribution of healthcare providers. That kind of goes back to chapter 7. There's activity 8-4, which is a series of kind of long questions in your textbook. And of course, your midterm exam will be posted in the middle of this. Thank you for watching. Have a good day.